Welcome to, or welcome back to, the Agatha May Detective Agency. I'm Agatha May, and in this video, we'll be looking at Mica Francis's medical records. If you're wondering how her records made it onto the internet, here's how I think it went down. Someone whose name probably rhymes with John Paul Miller released a stack full of documents and videos to someone whose name probably rhymes with True Crime Re. Here is what Ree said about having these documents and about releasing them. Quote, "I have a signed agreement of ownership over all materials prior to the agreement. I can release any and all as I see fit." End quote. I've had multiple people send me some of these records, so I thought we could take a look at them in date order. There is an entire record for the year of 2018 from Waccamaw Mental Health, and we've already talked about how stellar that facility is. This is from Mica's initial intake there on January 3rd of 2018. This was after she had been in McLeod Behavioral for 10 days following the episode she had after her augmentation surgery. It reads that Mica's symptoms were, could not slow her speech down, very rapid thought process, manic, and that these were a sudden onset of symptoms that began after her surgery. Mica states that since taking the medication, she had been moving slowly and wanted her medication regulated so she could function. She was taking Lithium and Zyprexa, which is a mood stabilizer. There is also a diagnosis of bipolar disorder with psychotic features. Now, I don't know why any hospital would give a diagnosis of bipolar disorder after only a 10-day stay, and after only one episode of what could have been a panic attack, a reaction to the anesthesia or post-op meds, or could have had a neurological origin, among a host of other medical conditions. But once that diagnosis of bipolar got placed in her medical record, she wasn't going to be able to convince any of the providers that she was seeing otherwise. If she had been able to go somewhere other than places like Waccamaw, she might have had a chance to have it removed. And look who was there with her at her appointment. Husband is supportive and is with her at this assessment. And also, her husband reports that she does not like the medication and is looking for a loophole to stop it. So that statement infuriates me, and it also tells me that John Paul was influencing Mica's mental health care. He was planting seeds in the minds of the providers, and they were lapping it up enough that they felt they needed to write it in her chart. And she didn't like the medicine because it turned her into a zombie, and that might have been because she didn't actually need it. A visit on February 1st of 2018 records that Mica was still having trouble with her meds, and once again John Paul was at her appointment. For the most part, husband answered questions. So what should have been on that chart was, for the most part, husband stayed in the waiting room and kept his great big yap shut. The report also reads, patient believes she is not bipolar, that she only had a nervous breakdown. We'll continue to work with them on finding the right medication. The providers should have stopped working with them and started working with her. Mica knew she wasn't bipolar and that the episode she had post-surgery was just that, an episode. On April 4th of 2018, Mica was seen for an appointment following a 1-week stay in the hospital due to an alleged suicide attempt. Now, this was when she allegedly tried shooting herself and the gun jammed. I don't believe that happened. I think John Paul convinced her and convinced the hospital that it happened. I wonder what the medical records from that hospital stay would show us. Did Mica tell the hospital that she didn't remember that happening? On June 20th of 2018, there's a note on her chart that one of her implants had hardened and she was going to need reconstructive surgery. If you have hardening of an implant, it can result in what's called breast implant illness, and the symptoms from that can be fatigue, joint pain, brain fog, dry eyes, memory loss, rash, skin conditions, hair loss, anxiety, and myalgia, which is muscle pain. Now, the implant hardening itself can cause severe pain, and severe pain can cause mental health issues. And with the other symptoms, I can only imagine how difficult that was for Mica. And in the middle of all this, she's having to try and fight mental health providers who are trying to pump her full of lithium and have given her what I believe even more now was a false diagnosis. The rest of the reports from Waccamaw for 2018 are much of the same. They tried to keep her on lithium even though she kept telling them it didn't work for her, and John Paul kept showing up to her appointments. Mica was back at the clinic on 2/19 of 2019, and I don't know who wrote this, but I wouldn't let them treat a guppy for mental illness, much less a human. Here is part of what they wrote. We discussed symptoms and warning signs in order to prevent further decompensation again, but she said she never knew. This shows how poor concentration and attention span she has, since I review it with her every appointment due to how severe and extreme her symptoms were. She recognized that she has a lot of delusional thoughts when she gets manic, and she needs to listen to her husband when he raises concern. I refuse to believe that whoever wrote this was any kind of trained medical professional. This has to be someone that just wandered into the clinic and decided to play counselor for the day. I was worried about the South Carolina Department of Mental Health before reading this, but now, if this is the kind of mental health treatment, and I use the word treatment ever so lightly, that the Department of Mental Health is doling out, South Carolinians are in trouble. And what is this she needs to listen to her husband when he raises concern? No, inept mental health provider, she definitely did not need to listen to him. Inept mental health provider goes on to talk about lithium levels and uses the phrase, on the other hand. And I mention that because it's used on another medical record and it stuck out to me because it's just a weird thing to write on a patient report. It's like saying, the patient is convinced that she invented the Ferris wheel. On the other hand, her hair looks fabulous today. In November of 2022, Mica was admitted to the hospital, and the medical records state that she's a 20-year-old female. Mica was 28 in 2022. She was given medication, but the chart doesn't state what medication because why would it? There is a note that patient is euphoric and describes feeling like she can fly and not be harmed. Well, that kind of sounds like she might have been drugged. But as far as I can tell, there was no drug screening done. Maybe the euphoric feeling was an effect of the unnamed medicine they gave her. There is also a note that most conversations and questions, patient diverts to conversations around her husband. Well, I wonder why that was. And we're going to come back to this record in a few minutes. The next medical record is for January 3rd of 2023, and Mica was being seen for akathesia, which is involuntary movement that can be caused by psych meds. And these notes aren't any better than the others. She decided to taper herself and stop. It doesn't say what she was tapering, though, and this is another report where the provider uses on the other hand. I don't know which of the two staff members listed it was that used that phrase, but Dr. Duchesne is the doctor who had a review left about her that she'd fallen asleep twice in a session with a patient. There's also a note on this chart about Mica saying that her sisters had put her in the hospital against her will and told her lies about John Paul. But remember this text that Mica sent to her brother Nate in early February of this year? She was telling him that someone at Waccamaw Mental Health had been lying about their sisters, and she was wanting to go confront that person. And that was just a couple of days before John Paul had her involuntarily committed. One final thing to point out on this is the note that reads, prior to hospitalization, she believed that she was pregnant and that her son was coming to save the world. There's nothing to indicate where the provider received that information. And it was already used in a text message that John Paul said had come from Mica back in 2017. So maybe John Paul was just recycling old stories. And that was the text that ended with, sent from my iPhone, which would make it an email, not a text. And he's the one who uses sent from my iPhone because he thinks people actually care that he has one. The last medical record is from February of this year when Mica was involuntarily committed. This record is basically saying that Mica was fine at the time the assessment was written, and it also reads that will not start lithium as patient openly admits attempting or wanting to get pregnant. Increased Seroquel. Okay, first off, I think that Mica figured out that the only way they'd stop trying to shove lithium down her throat was to tell them she wanted to get pregnant. But knowing that, why would they keep her on Seroquel? It should only be taken when pregnant, when the risk of not taking it is greater than the risk to the fetus. None of these reports make sense. Now let's look at that record from 2022 again. You see how it's printed on the front and back and how the paper is thin enough to see through it a little? Well, something fun you can do in Photoshop is to reverse the image horizontally like this. Just flip it around. Then if we mess with the contrast and adjust the black and white concentrations and maybe sharpen it a bit, we can see this part. Now it's not clear, but you can read it, and it reads, "Access to firearms. Reports husband purchased at least 6 new guns." Well, isn't that interesting? Mr. Don't let her have a gun or she'll use it on herself decided that having a half a dozen or so of them in the house was just the best idea ever. It's almost like he wasn't really worried about her being around guns. And I don't care if they were in a safe inside another safe. If he was actually that worried, he wouldn't have them in the house. It seems there must be another reason that John Paul is pushing that whole "if she has a gun, she'll use it on herself" narrative. I've seen a few videos that someone named Tracy Citrullo has posted on TikTok of Mica. And I guess these videos are supposed to show that Mica had mental illness, but they don't. All these videos do is hurt Mica's family and make John Paul look even worse than he already does. In one of the videos, Mica is asking John Paul about Abigail and David from the Bible and who their son was. She was just trying to figure out the connection, and John Paul was acting like she was talking about seeing a 2-headed tap-dancing cow that was singing Blue Moon over Kentucky. So in the video, Mica keeps trying to figure out who is who and is asking John Paul questions, and this putt starts crying. Crying. Like Mica was so off her rocker that it just brought him to tears. And he felt the need he had to video this. It is just a perfect example of gaslighting. He was trying to make Mica think that she wasn't thinking straight. I have yet to see a single video of Mica behaving any way other than perfectly sane. Now, John Paul, on the other hand, is a completely different story. So the more that John Paul and his groupies put out medical records and videos, the more it shows us that Mica was not the woman he portrayed her to be. The more we learn, the more heartbreaking Mica's story is. So when it comes to who to believe, I'll keep reading Mica's list and believing her own words over anyone who is trying to call her a liar. Thank you so much for watching and for being patient with me while I'm navigating the changes to my channel. Until next time, stay safe and be happy.